we have covered the upper extremity in the dissection classes, and some of these upper extremity classes is been taught in the lectures as well. So we are just like running through this particular upper extremity in the arm and forearm regions, the muscle, nerves and the soft tissue structure, blood vessels, etc., which is relevant, which is required for us. We have to have an understanding of it. We will be just like breezing through that particular part. So let's deal with this particular arm. So what we study or what we know so far, arm has a single bone which is known as humerus, which splits this compartment with this particular intermuscular septa into anterior and posterior compartment, right. So this particular anterior compartment and the posterior compartment have got muscles, have got nerves which are running through, which supplies the muscle, or it may be traveling through, not supplying through it, reaching to the lower part of the arm. Now this posterior part and the anterior part have got muscles, and accordingly these muscles are doing some kind of jobs. We call them as flexor muscles or extensor muscles, depending on how these particular muscles are making a movement on the joint. Which joint they are moving this particular joint, we call them as elbow joint. So how they are behaving or working on this elbow joint, we call this as muscles of flexion or muscles of extension of elbow joint. If they are folding the joint, we call them as flexion. If they are unfolding it, we call them as extension. So the muscle which is present in the back side, which is a three muscle or three head muscle, which is present on this side, we call them as triceps. They have got three heads on it. We call them as long head, lateral head, medial head, based on how they are placed, laterally placed, medially placed and long placed, right. Apart from this particular large muscle, we have a small tiny muscle, bit of it is present on here, we call them as anconia. So we have two muscles to worry about in this particular compartment. So one is triceps, other is anconeus. Good. The functions of this muscle is unfolding of elbow joint. We call them as extension. Good. Easy. Now coming to the front compartment, they are doing the opposite the extension compartment is doing. What they are doing? They are bending the joint or flexing it. That means they are known as flexor compartment. So we have three muscles to deal with here. So we have a muscle which is present in the deep side, which is largest of all or strongest of all, and then on top of we have two head muscle present on it and a small tiny key muscles. So we call them as BBC, biceps brachialis and coracobrachialis. These muscles are producing a common actions to this particular joint over here, which is known as flexion. So these are known as flexor compartment, extensor compartment. Now if you have muscle, if they are moving, they need a nerve to move this. The nerve which supplies this BBC, all three of it, is MCN, musculocutaneous nerve. If you split the name, we have a muscle and has a cutaneous. That means it's a mixed kind of nerve, capable of doing motor action and sensory actions, right. So motor actions of this musculocutaneous nerve is move the BBC. What these BBC are doing? Flexing this particular what joint? Elbow joint. That's a one function. That's not the all of the function that we are referring, but one of the prime functions to make this particular thing simple. Now similar to this particular extensor muscles which are present on the back side, to move the muscle we need some kind of muscle to work on it, a nerve to work on it. We have all the muscles in the back supplied by one nerve only, which is radial nerve. So the radial nerve is supplying all these back muscles which is present in this region. All the heads are supplied at different level, they are supplied. So we do not want to make it complex which level they are supplying, we just like to take it. All the three heads are anconia supplied by which nerve? The functions of these muscles are extending what joint? Elbow joint. They don't have any actions on the shoulder joint. So don't get mixed up with it. Shoulder joint is above it. We are not dealing with the shoulder joint. Good so far? Now from this particular arm we are moving to forearm. Likewise this particular arm we have in the forearm, how many bones we have? Forearm e kota bone ache re? Ki bone? Naam ki? Acha, rest. We have this particular radius and ulnar. For example, they are joined by the membrane, we call them as interosseous membrane, and they have this intermuscular septa as well. Splits this into two simple compartments, front compartment, back compartment. Front compartment is fleshier, back compartment is skinnier. That means বোঝা যাচ্ছে back side টা আমাদের skinny, এটা here. সুতরাং if there it is more fleshy, that means the flexion compartment is more stronger. and extensor compartment is lesser or weaker compartment. Now talking about this particular muscle, say for example flexor compartment and extensor compartment. So we have these muscles which are present in the extensor compartment, which we have learned and dissected too. We have the muscle name with the extensor muscles. So we have learned the muscle extensor carpi radialis longus, extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, all these names which is present on here. So all these muscles which are present on these regions, we have to know these particular extensor muscles, how they are placed. Now all the muscles which are present in this particular region is supplied by a single nerve, that is RAD. The principal functions of this radial nerve or this particular muscle to extend the which joint? Wrist joint. So beyond this elbow joint we have the wrist joint. So all the extensor muscles of the forearm will be working on this joint. What joint? Wrist joint. So they will be extending the wrist joint. So extension of wrist joint or wrist will be acting on this. Similar to here, we have this particular flexor muscles. So flexor muscles are likewise all the muscles which are present in here. So we have the pronator arteries, we have this particular flexor carpi ulnaris, we have this flexor digitorum superficialis profundus, flexor carpi ulnaris, etc., etc. All the muscles which are present on this region. So we have to memorize all the names, and as well as in deep compartment we have this pronator quadratus. So all the names which are present on these regions, we have to know these particular muscles in this compartment. So here we have a split. What split? The muscles in the back side, in the front side is supplied by two different nerves. So there are two nerves which are presently supplying the muscle. So we have a muscle which nerve we call them as ulnar nerve. We have a nerve we call them as median. Median with N. They are supplying this particular region. So median is supplying the majority of it in the forearm, and ulnar is supplying only less, 1.5 is supplied by this particular muscle. So ulnar is supplying a muscle, we call them as flexor carpi ulnaris, all of it, and a muscle, half of a muscle, we call them as flexor digitorum profundus. So this particular flexor digitorum profundus, half of it, that means ulnar half. That now which is ulnar half? If you just place the arm in extension or in anatomical position, this side we have a bone, lateral bone. We all have this bone is radial bone. This side we have opposite side, which is medial side. We have ulnar bone. So this flexor digitorum profundus is a muscle which is going to all these fingers, which is deep muscle. Profundus is a large deep muscle present deep inside the forearm. Now this particular flexor muscle, if it is present in here, we can split this in the medial half and the lateral half. Medial half is the ulnar half, lateral half is the radial half. So this flexor digitorum profundus, the lateral half is supplied by the ulnar median nerve, and this particular half which is present on this side, ulnar side, is supplied by the ulnar nerve. So if you just like split this particular muscle as flexor digitorum profundus, the half of the muscle is supplied by UN and rest half is supplied by MN, median nerve. So this is the only difference in this front side regard to it. Now coming to the actions of this muscle, they are doing flexion. Where? Which joint? They are flexing wrist. So wrist and elbow, you have to just mention about this particular region to it. Apart from this particular flexion and extension, we have another action which needs to be considered out here. We call them as pronation and supination. What is pronation? What is supination? So we have to fix this particular arm in 90-degree positions, bending this particular elbow joint. We fix it. Now once we fix it, we have a movement which is turning down and moving up. So it's a pronation and supination. So when we are doing supination, this particular palm is facing up, and when this particular palm is facing down, we call them as pronation. So this particular action is kept in a position where we have flexed it in a 90-degree position, fixed it with the side of the body, and then we are doing it. This particular action is used for twisting something or hammering something. When you are doing hammering in a twisted manner, then we use this particular action conjunction with the flexion and etc. But if you want to solely explore this pronation and supination action, we have to just like flex it and doing pronation, supination, right. So, this particular pronation and supination is a different kind of movement which is present in here. So, we have to consider this particular elbow joint or beyond elbow joint movement, we call them as pronation and supination, right. Now, to do this particular special action, we have a special muscle, we do have special muscles which are doing this particular supination and pronation accordingly. So, we have a muscle, we call them as supinator, and we have a muscle, we call them as brachialis. So, these two muscles are supinator. Amongst this, the brachialis is the strongest one, right. And apart from that, pronation, we have the muscle which named with pronator teres and pronator quadratus. So, pronator teres and pronator quadratus, they are doing this kind of pronation supination action. So, we learned 3 sets of movement: flexion, extension, pronation, supination. Pronation, supination is not only limited to this particular elbow joint. We need this particular joint, we call them as radio-ulnar joint. The joint or union between radius and ulna, this particular joints are basically responsible for this kind of pronation and supination actions. They are not limited to this particular elbow joint or wrist joint. So, we call them as radio-ulnar joint movement, which is in conjunct to this particular thing is going on. So, flexion, extension and pronation, supination, and their set of muscles which are involved in this particular phenomenon, we have to know this. Clear? Good? Right. Now, let us talk about the soft tissue structures. That means the nerves and the blood vessels. So, the easy thing to consider here is the blood vessels. Say for example, artery. So, we have to know this, there is single arterial supply which is present in this particular region. So, we have an artery which is coming down from this particular chest or thorax region, we call them a subclavian artery, SCA, which is a branch from this particular arch of aorta. So, subclavian artery changes as it courses down, reaches to the axilla, we call them as axillary artery. Now, axillary artery we learned about can be split into 3 segments, 1, 2 and 3, depending on the segments how they are there. So, as this particular axillary artery crosses this teres major, goes down to the arm, we call them as BA, brachial artery. Now, as this particular brachial artery reaches to the cubital fossa, it splits into 2 terminal branches. We call them as radial half and ulnar half. So, there will be the radial artery and ulnar artery. They are going to the radial directions and ulnar directions. So, this is in short about this artery. Now, this particular brachial artery, their relationship of this brachial artery with the soft tissue structure in the cubital fossa before it splits into 2 is important for us. Now, what is cubital fossa? We have dissected this particular space which is related to anterior to this particular elbow joint. So, we have digged this particular joint space in this region. So, this particular region we have seen a neuromuscular structure is present in here. So, this artery is reverse thing. So, this brachial artery is splitting in this particular fashion out this region. Now, apart from there, we have this particular muscles which are present, which are related to this particular conjunctions in this particular cubital region. We have a muscle laterally placed, we call them as BR, brachioradialis, and we have a muscle we call them as pronator teres. Now, in between these, joining this particular 2 elbow bones about this particular condyles, we find a triangular space in this particular front of the elbow. We call this triangular space as cubital fossa. Now, this particular cubital fossa is limited by these particular muscular boundaries, laterally brachioradialis muscle and medially by pronator teres. They are kind of making this space. Now, within this particular space housed is this particular neurovascular structure. So, we have to know this particular relationship of the neurovascular structure that are present on CF, cubital fossa. So, we have this artery, we have seen that brachial artery splitting into this particular branch as it descends down to this apex of this particular triangle. Apart from that, we have an ending of a big muscle from the forearm which is coming on this particular region. So, we have a biceps brachii muscle and that biceps brachii muscle ending into tendons like that. So, this particular tendon of the biceps brachii can be placed in this particular region, and as well as next to it we find a nerve running deep to it. So, the nerve which is running deep to it is median nerve, and then we have this artery BA, and we have this particular tendon of biceps brachii. So, these three structures, tendon, artery and nerve, TAN, from the lateral side to medial side is placed in here. So, this relationship that you have to keep in mind in this particular cubital fossa. Why? Because we place the bell of the stethoscope to measure this pressure of the individual over the brachial artery. So, we clog this particular artery by the compressing on this particular pressure on it, stop it, and put the bell of the stethoscope, and then finally release the pressure and see that how the blood flowing through this artery. Now, if we do not know this particular relationship, we cannot accurately place this bell of the stethoscope. So, we have to find this particular tendon, and then we have to place this particular tendon which is present on here on this particular side, and then we have to place medial to that particular tendon is brachial artery, then we have this particular median nerve. So, we have to just identify this particular tendon, then place bell of the stethoscope medial to it. If you place this particular bell of the stethoscope laterally, you are not going to hear this particular sound which is we are intending to hear whenever you are unflating the cuff. So, this particular relationship in physiology you are going to learn about measuring the blood pressure. So, for that this relationship is important. As a result of this particular content and the structures in the CF cubital fossa we have to know a bit. Now, coming to this particular brachial artery, it is splitting into two terminal branches, radial artery and ulnar artery. Radial artery and the ulnar artery, out of this ulnar artery sends a branch in here like this. So, we call this as common interosseous branch that goes deep along with the interosseous membrane. What is interosseous membrane? Interosseous. If you split the name, you get this particular thing. Osseous means bones. Inter means that is the in between them. That means this membrane which is present in between this particular two bones in the forearm, they are thin fascial structure there. We call them as interosseous membrane. That interosseous membrane is comparting between this particular region of this flexor side and extensor side. So, this is interosseous. So, this particular branch of this particular artery, ulnar artery, which is deep artery, we call them as common interosseous branch. This common interosseous branch again splits into two branches, anterior interosseous, posterior interosseous, goes in front of the interosseous membrane, back side of the interosseous membrane, running through the entire length. So, this particular interosseous branch is an important branch. As you have seen this particular forearm, we just remove this and send this particular interosseous branch. So, this particular posterior interosseous branch is important for us to identify if it is in exam, deep dissection is there. So, that is important to us. But anyways, so this particular ulnar artery and radial artery coursing down and sends this particular muscular branches and reaches to this particular region, we call them as palm. Reaching to this particular palm, this particular branches of these arteries breaks down into two branches. We call them as superficial branch and deep branch of this radial and ulnar arteries. So, this superficial branch and ulnar artery and this deep branch of ulnar artery make two anastomotic channels between themselves. So, this particular channels which is present in here, we call them as arches or palmar arches. So, this particular palm, we see this particular exchange of this particular arterial branches between these branches of radial artery and ulnar artery at a superficial plane and a deeper plane. We call them a superficial palmar arch and deep palmar arch, and this is how they are ending. So, they are making kind of communications between themselves. So, this is how this particular entire artery is ending. Now, this particular radial artery is important for us for measuring this particular pulse, and as well as this brachial artery is important for measuring this. So, if you just see this particular artery pulsation, if you are placing this particular hand over here, we feel this particular bone, lower end of this particular radius, we try to feel this particular on the bone, the pulsations over there. We have a tendon of this particular brachioradialis which is going down, so medial to that or inside to this particular tendon of this particular brachioradialis, we see this pulsation and we can find this arterial pulse of the radial artery. Ulnar arterial pulsation, that can be visible as well, but it is little bit deep seated. As you have seen in the dissections, this artery is superficial and this artery is deeper. I have to just like a deep to identify this particular ulnar artery whenever we are doing this particular forearm or arm dissections. So this is in short about thing about brachial artery. The brachial artery in the arm sends a prime branch, which is point of interest for us is that it gives a posterior branch. That posterior branch is called them as arteria profunda brachii or deep brachial artery, that goes in the back side, right. So the back side artery which is coming from the brachial artery, we call them as deep brachial artery or profunda, that is the deep branch, large deep branch which is going in the back side. They run along with this particular nerve. What nerve? In the back side in the spinal groove? Radial nerve. So they run in the groove in this particular region, and if it is broken by any chance, we have a chances to injury of this particular nerve. So this is about this blood vessels which is supplying to it. Now coming to this particular nerves. So few things about nerves, we already have summarized this particular nerves. So musculocutaneous nerve, it is having a muscular BBC, and cutaneous, it is supplying the lateral side of forearm. So it forms the lateral cutaneous nerve of forearm. So it forms the lateral cutaneous nerve of AFI. You remember that branch we talked about, medial cutaneous nerve of forearm, medial cutaneous nerve of arm. That is a branch which is coming from this brachial plexus, medial trunk. So counter to this medial side, we have this lateral cutaneous nerve of forearm. So this lateral cutaneous nerve of forearm is nothing but a branch from musculocutaneous nerve, which supplies the lateral side of the forearm till this particular thenar. This particular region we call them as thenar eminence. It supplies this particular region, lateral side. So touch pain temperature on the lateral side is picked by musculocutaneous nerve branch, and the medial side is supplied by the medial cutaneous nerve of forearm. This side medial cutaneous nerve of arm. So this is how this cutaneous distribution of musculocutaneous nerve is going on. So coming to this particular median nerve. So easy thing about median nerve is in the arm no branch. In the forearm it supplies all muscles in the front of forearm except 1.5. What 1.5? Flexor, profundus half and flexor carpi ulnari. So 1.5 is supplied by ulnar nerve, right. So except this, it is supplied by the forearm front muscle, it is supplied to it. In this palm region, it supplies few muscles. In the palm region, we have two domains. When if you look at your palm, you see that there is an elevation there. Below or under this region, we call them as thumb. See sir? This is a bump which you are seeing here. This particular thumb, under to thumb. We call this thumb under the thumb elevation as thenar eminence. T-H-E-N-E-R, thenar. This is the largest bump which you have in the palm, thenar eminence. So deep to here we have muscles. We call them as muscles of thenar eminence. There are few of them. We are not knowing the name right now. So these thenar muscles, if you know these names of the thenar muscles, thenar groove muscles, we find. We call them as thenar groove muscles. This bump. Opposite to this thenar groove, we have another less prominent bump. We call them as hypothenar. Hypo means less. So this which is below this pinky, this region. So we call this as hypothenar eminence. So muscles which are present in below this region, we call them as thenar muscles. Muscles which are below this pinky, we call them as hypothenar muscles. Muscles which are present between these fingers, we call them as lumbricals and interossei. Lumbricals means worm. There are 4 lumbricals are muscles are there in this region, and the interossei are there. So you call them as dorsal interossei and ventral interossei, or palmar interossei, dorsal interossei, like that. So these are the small muscles, they are precise muscles, right. So in this particular hand region or palm, if you just like categorize the muscles into 3 or 4 groups, so we call them as hand muscles. To start with, we memorize in this way. So thenar muscles, T-H-E-N-E-R, thenar group, and what is that other group? Hypothenar group. And other than small intrinsic muscles, which includes two of them, lumbricals, interossei. Interossei are of two groups, dorsal and palmar. So this is how this particular divisions of muscles are there. So thenar group, hypothenar group, and small intrinsic muscles of hand. They are all of these muscles. So individually, if you cannot remember all of them right now, it is not important. Right now, what we remember, this group, thenar group by the thumb, hypothenar by the pinky, so which is little finger, right? So these two bumps and anything beyond, we call them as interossei muscles. Interossei may be lumbricals or interossei. Interossei group muscles are of two types, dorsal or palmar interossei. If you can remember this much, or else one group, two group, three group. Right now this three is good enough, right? So now this grouping, why I am saying this thenar group muscle is supplied by the nerve, we call them as median nerve, and rest is hypothenar and this intrinsic, that means 2 and 3, which are supplied by ulnar nerve. Got it what I am trying to say? So muscle actions we are talking about of the palm or hand. Hand muscles can be divided into three groups. What are the three groups? Thenar, big bump, less bump, hypothenar, small muscles, intrinsic. Intrinsic small muscles, right? This group. Thenar group supplied by nerve, median nerve. So how many of them are? 3 or 4, whatever it is, just forget about it. So thenar group muscles is supplied by median nerve. Rest is ulnar nerve, right? So make it simple. So palm, thenar. This is the supply of median nerve. Now let's talk about ulnar nerve that covers the whole story. In arm, ulnar nerve, no supply, no muscle is supplied by in the ulnar nerve in arm region. Forearm, what muscle is supplied by this particular ulnar nerve? 1.5 flexor carpi ulnaris, all of it, and half of, good. And hand and palm, which group is supplied by this ulnar nerve? Hypothenar plus small intrinsic. Make sense? That's all about nerve supply in this. Musculocutaneous, median nerve, ulnar nerve in this region, and rest we are left with radial nerve. What supplies the radial nerve? What nerve muscles is supplied by the radial nerve? All of it in the back side. Name any damn muscle in the back side of the forearm, arm. Everything and anything is supplied by, so everything is backside radio or radial nerve. Clear? So backside, red, all back. So all back boys listens to radio, right? That's it. So how much time it takes to study upper extremity? 2 days. For me, 2 hours. This much covers 60% of it. Whatever left it is breast and this axilla and that thing which you have drawn. That's the 40% thing. Brachial plexus drawing, that's a 20%, and mammary gland, lymphatic drainage, axillary boundaries, triangular quadrangular space, the relevant thing is rest of it. So how much time you should be devoting to this particular studying anatomy? None. You're done. Finished. Only joint that you have to study, shoulder joint, flexion, extension, adduction, abduction. Point of contact, point, huh? Clinical questions, yeah, that's the thing you have to study. So if you know this logic, then you can study this. Unless until you know this particular stuff. So 2 days for studying all the things, and rest 2 days is for studying clinical anatomy.